Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Is your calf pain a blood clot?
My
This is-
cat.
Calf!
Oh, calf.
Yeah.
Okay, no, I mean, I don't know.
This is actually a very serious subject.
Right.
I mean, if you get a blood clot in your calf, and I'm gonna talk about this right away.
Sure.
That clot can break off, or a piece of it can break up, travel up into your lungs, and actually block off an artery in the lung to the point where it kills off that part of the lung, and you're gonna become short of breath, and it can kill you.
Sure.
There's 600,000 cases a year, and of those, 60,000 people die. So.
And the technical term is deep vein thrombosis, right?
Because it's a deep vein, and thrombosis means clot. To give you an example, Brad, I don't know if you remember David Bloom. He was a reporter for NBC during the Iraq War, and he got it from, he was 39 years old, healthy, but he was traveling around in tanks with the troops,
Right.
and he was immobile for a long period of time, and that's probably one of the number one causes of it, is the
Right.
immobility. And he actually developed the clot, went up to his lung, killed him.
Right.
So, I mean, this is a serious subject.
And so we're gonna go through a test that physical therapists use on a regular basis.
Very simple tests, and kind of some of the things we look for.
Sure.
And it's called the Homan's test, or Homan's sign. Right. And I've probably assessed at least a half dozen, Brad, and that I was right on. And I've been wrong too, and I know you've been wrong.
Right.
It's better to be wrong and send somebody in
Right.
than to, not send them in.
Right. So in other words, you perform the test, which takes about a half a minute.
Right.
If the tests are positive, you send them in, and then they get the test through an ultrasound.
Right, like a Doppler ultrasound.
Right, and that confirms it.
I think they could do an MRI too, but ultrasound is so much cheaper, and they always do an ultrasound.
Right.
Right, so.
And if it's positive, they take, they'll take care of that, we'll get into that. If it's negative.
Coumadin, warfarin, they'll put you
right.
on something,
Right.
yeah, exactly.
If it's negative, they come back and, that's good news.
So, all right, Homan's test, very simple. First thing what I do, it generally happens in the calf. I know a thrombosis can happen up in the thigh too.
Right.
I've never seen one. I know it happens,
Right.
but I just never have seen one. So it always seems to happen in the calf for me. You're going to notice first off that it is swollen, especially on one side compared to the other.
Right.
And you're going to have swelling after surgery quite often, so that alone is not a sign.
Right.
So I also have noticed usually there's some redness. The person themselves may feel some burning pain. There's going to be sometimes pain and discomfort there, but this is burning pain quite
Right.
often. So swelling, redness, some pain, and probably roll down the. So all right, you're going to have the legs straight. Now they can do this in bed too, very easily. And basically, what we call is dorsiflex the ankle. We bring the toes up towards the head.
Toes towards the nose.
Towards the nose, there we go. And sometimes that alone will bring on the pain.
Right.
And if not, you squeeze here, and it's not usually very subtle. Right, Brad?
Go ahead and do that.
Yeah,
If
and
you
I
go,
like that.
ow, and then, the
Yeah,
person
they're-
usually
yeah.
eyes are open, they'll jump up.
That's what really alerts me to it. If they go, and the other thing I'll often do is I'll squeeze on the other side too, Brad.
Sure.
And then they go, ow, just as bad.
Yeah.
And I'm like, they're just a very sensitive person, or their calf is really sensitive.
Right.
But that's a simple test, the Homan's test. And if there's some reason why you could have a clot, then you're more likely to go have this checked out.
Sure.
So should we talk about some of the risk factors? Brad?
Well, I guess in my experience, I'll do the same test. I'll look for the swelling, but there's swelling for other reasons.
Right.
I'll squeeze here, it might be painful. I'll dorsiflex if that's painful. But I found that, it's a judgment call. Is it just a ouch, or if it's a ow?
Every time I've seen one, Brad, what I do is I bring a nurse in then too.
Right.
Every time. I go,
Right.
this is what I'm seeing, what do you think? And quite often I concur.
Right.
So.
And if it's in a gray area, I'll send them in.
Yep, you send them in. Especially, a lot of the people we're seeing are after surgery, which is of course one of the risk factors.
Sure.
Let's kind of go down the list, Brad. Again, prolonged bed rest, but the other one is that a lot of people do is sitting in a car or sitting in a plane for a long period of time.
Right.
So what should they be doing just to prevent this?
They could be doing some ankle
Yeah,
pumps.
can you see this at all?
Yep, working those ankles
Yeah.
all the way up and down, not just little wigglies, but
Yeah.
good, meaningful agent
I do
pump.
these on the airplane all the time, Brad.
Sure.
I'm tapping away or pumping away. The other thing, which actually I didn't know, is dehydration makes you
Sure.
more at risk. So
That
you wanna make
makes
sure
sense.
you keep your fluids up while you're on the plane. If you might have inherited a blood clotting disorder. You know, if your parents have had it.
Sure.
If your parents had a DVT, a deep vein thrombosis, you're more likely to have one too.
Yeah,
So.
there's nothing you can do about that.
Yeah, there's nothing you can do about that, but what you do wanna do is make it be self-aware that you may be more likely to
Right.
get one. Another one, Brad?
Smoking,
Smoking, yep, that's always one.
right?
Obesity, heart failure. You wanna
can't
keep
read
going?
writing.
You can't, Brad can't read my writing.
There's a whole list.
Inflammatory bowel disease. Age, if you're over 60. We already said family history. Pregnancy, did you say pregnancy?
No.
Seems like everything happens with pregnancy, doesn't
Right,
it?
yeah,
If you're on birth control pill or hormone replacement therapy. I think that's the vast majority of it, Brad.
And
So,
treatment, like we said, usually it's not the therapist's job to
Right.
treat. Oftentimes, if they have one, we're not gonna walk them.
Right,
You know, they're gonna stay off of it because we don't wanna irritate it. We'll
Right.
put them on the warfarin, some kind of
or
oral
Coumadin,
medication.
yeah, something like that. And that's of course in your family doctors or your doctors.
Right, and the idea with that is it's gonna dissolve the clot and it's gonna break
Right.
it up, and
Exactly.
that usually takes a period of time.
Yep, it does.
Mhm.
So, that's it. There's nothing much more to it, Brad. Do the Homan's test and again, don't be playing with your life here. If it looks like it's bad, go in and have it checked out.
Right, and on the lighter side, we can fix just about anything outside your leg except for
a broken heart.
broken heart, yeah.
Oh, you're
But
smart.
we're working on that, continue to do home study work on that, we talk to our spouses about it. We're gonna get good PhDs
No,
on
we
that.
won't. No,
We
we
won't?
won't.
Well, we
Thanks.
might.